Welcome back to the FemStrong Plus East podcast. In this series, we're chatting with physical therapist Dr. McEachern about things that we're curious about. And today, what we're curious about is Sean's recent injury from his jiu-jitsu competition that he did. So let's get into it. People are wondering. People keep asking Sean. He's having to answer the same questions a whole bunch of times. So I just decided, let's sit down and you can answer all those questions in depth. And anyone who's curious can tune in. So here we go. Sean, can you please tell us the sad tale of your recent injury?
It's not that bad.
What happened?
You're making it seem like it's
not that bad.
It's not that bad.
He's fine.
Yeah, I'm fine. So I competed at the ADCC Open the day before the East Coast Trials. Vince, John, Jiu-Jitsu, yep. So we had a big group that came with us, so it was fun because they did the trials, which is sort of a big thing. And I didn't want to do trials. I wanted to do the Open.
Yeah.
And I also wanted to do Masters. I think
for what reasons?
Yeah, I think it's good to challenge yourself, and I think it's beneficial for my learning because when you compete, it sort of really exposes all your holes.
It does.
And so I've been competing recently, but I choose Masters and I choose the Open mainly because I know where I belong. My jiu-jitsu's okay. But I also want to compete against people that have jobs and
maybe aren't going to be so fiending.
Yeah.
Maybe you're going to come in with a little bit more like, let's
work some stuff out.
Let's have a round.
Yeah.
I'm not trying to
I'm going to go hard.
I'm going to go hard, but I'm not going to do weird shady.
I'm going to give you time to tap.
If I need to.
However, the guy that I competed against.
In an ideal world, that's kind of what you get when you go Open. That's what you're signing up for.
Yeah.
But it's not quite what happened.
That's not what happened.
At all.
Yeah. I got mirror locked, which is like a shoulder lock, but also an elbow lock. So it's very similar to like this Americana, but with the arm in close, and you give pressure this way. And the only way that you can do this is fast. That's why it's not done that much, because you have to be aggressive with it, or else it doesn't work. So you don't really see it in competition. Sometimes at the highest level, you'll see people kind of rip on it, but then they escape their arm out. It's not a very good submission. It's kind
not
of
a very high success rate.
No.
And also, like, no control required before.
Correct.
It's something you just have to throw on,
Yeah.
hope it hits. If it does, your opponent's injured and you won.
Yeah.
And if it doesn't, you don't have a control position, you'll continue working against it.
Most of the time that it happens at the highest level, people just let it happen. And they just keep going with it, even though it hurts. So that's why most of the people don't do it, because they're like, I'm not going to tap from that. And so they just keep going. It's not a real submission. Similar to like people not tapping from leg locks or things like that. They'll let their knees snap. Have you seen this?
Because they don't realize?
No, it's...
Or just because they don't want to tap?
It's like an ego thing.
It's so wild.
Yeah, quick tangent. This
Yeah.
is super deep into jiu-jitsu, but it's not like leg locks are new, but they're kind of new.
Yeah.
Gi was, or jiu-jitsu was mostly done in gi. And leg
Just the
locks,
pro thing.
yeah.
You don't know jiu-jitsu, the gi is the thing.
And the belt on, yeah. And so since no gi, which is like athletic gear, got more popular,
Just in leggings and around
the leg lock game started to become more prevalent. People started to win more with leg locks, and so the leg lock game got really deep, and the technique just kind of spread. But the old school people were like, it's fake.
Oh.
It's fake. Like, you're not incapacitating me. You're just injuring my knee, but I can still continue to fight, so I'm not going to tap from it. Whereas, like, if you have someone in a choke, and you choke them unconscious,
Got it.
right?
So wait, they'll let them finish the submission
Yeah.
to the point of injury, but then continue along
Yeah.
because it's not the type of injury that they respect.
Yeah.
That's fascinating.
Yeah. So there's a famous match against Craig Jones and
Craig
Vinny
Jones?
Magalhães, this Brazilian guy.
Wait, what's the?
Vinny Magalhães. And he doesn't tap to leg locks.
Vinny doesn't tap.
Vinny doesn't tap to leg locks. And Craig Jones is a very good leg locker. Yep, leg locked him. Same submission twice. The first time, big pop. Couldn't get out and didn't tap. So Craig Jones is like looking at him like, dude, are you okay? And he's like, no, it's fine, it's fine, it's fine. So then he goes again, and then he slips his leg out. But both times, like, you can see his knee moving way too far.
As a physical therapist, what do you think of me doing that?
I think first I'm thinking how dumb,
Yeah.
and then I'm thinking not only have you completely torn the ligament, but now anything else, like the joint capsule, that shouldn't have tension on it because there's ligaments, is now being completely ripped
Right.
apart.
Yeah. Gosh, that's wild.
Yeah, yeah. And it's on YouTube. You can watch this.
Yeah.
It's really, really crazy.
We'll link to it in the show.
Yeah. But back to my story. So I got mirror locked, and I tapped immediately. Didn't really have time to tap before the damage was
It was
done.
really fast.
It was super, super fast.
Way fast,
Yeah. So pretty immediately, I started to examine myself.
I'm sure. You were checking in and you were like,
Yeah. I just wanted to know, like, is it broken?
yeah.
Like, do I need to go to the ER, or like, is it a complete tear of the ligament where I need to start thinking about surgery, or is it like fine and it just hurts really bad?
Okay, let's run through those. So this is part of what I'm excited about for this interview is you have a unique perspective when you get hurt.
Yeah.
Because you have these very clear avenues of like, in this circumstance, this is my course of action. Here, 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 here. Can you kind of explain those a little more?
Yeah.
If you were taking off what your avenues might be.
Mhm. So the way that we sort of frame it in physical therapy world is red flags.
Okay.
And this can apply to a bunch of different things. There's not really a clear cut on what a red flag is.
There's really not. Sometimes it's confusing.
Yeah, yeah. Very. You kind of have to ask a friend sometimes.
Sometimes you do, but.
Yeah. There are very clear red flags, like broken bones and, you know, like.
Bone out of the flesh.
Yeah.
That's a problem.
Yeah. Or like if you suspect.
Or if you can't move it.
Yeah. And really we're thinking about like what do those signs tell us? Not just what are those signs, like why is that a red flag? Does he have potential vascular issues? You know, like if you have a spiral fracture of your humerus, of your arm, there's a bunch of vessels back here that could potentially be damaged.
Yeah.
And so that's a huge thing. If you have like a complete compound fracture, there's shards right next to the arteries. And so you start thinking about different things. Same thing with like a shoulder dislocation. If it's anterior, you're totally fine. You pop it back in. There's lots of damage, but you don't have to worry about anything. Where if it's a posterior, boom, red flag. Do not touch this thing.
Because it could damage arteries.
Because it can damage arteries. Also, it's like very immediate that we have to go to someone who's a professional to relocate it. That is not me. Yeah, I'm not trained in relocations. I have an idea of how to do it, and I've done a couple of them before, but it's not my specialty.
So if you were the only option in like 1,000-mile
Yeah,
radius,
and it was anterior, I would, and he was totally fine with it, I would try it.
Yeah.
But if
it's posterior,
if it's posterior, not gonna touch it.
not gonna touch it.
No, because you don't know what's happening with the blood vessels back there, and you reset it and it tears them.
Yeah.
So there's red flags that I'm thinking about.
And are those the red flags that you're thinking about? Like, what are the red flags you're thinking about
Yeah.
in your instance?
Yeah, I was thinking about a shoulder dislocation.
Okay. Posterior?
Anterior.
What it had meant, okay.
It was anterior, yeah. So
What
this
did
is
I-
typically forward.
Got it. Whereas the other?
Yeah.
Okay.
So I was thinking about dislocations. I was thinking about broken bones,
Okay.
possibly like my ulna. And then I was mainly thinking about ligaments because I can quickly tell like I can kind of move it, and it doesn't feel like it's restricted or like feels weird and unstable. It was mostly just here that hurt really bad. And so I sort of knocked those red flags out pretty quick, and then I started thinking about the ligament. Did I completely tear the ligament? Is it dislocated? and then I could kind of see that it wasn't dislocated.
Because if it was dislocated, you would see that it was like balled up.
It would be very obviously like a different shape. It would be like boom, sticking forward, and probably wouldn't be able to move it at all. It would just be stuck. So then the sort of concern was tiered down. I'm like, okay, it's not an emergency room.
Yeah.
Nothing's dislocated. Nothing's fractured. I'm relatively fine. I don't have to like examine. I'm fine with all the red flags. I can stop like.
I don't need urgent medical attention.
Yeah.
Earlier you said, am I considering emergency room? Am I considering, am I gonna maybe need surgery? The first two you said, like top tier.
Yeah.
Those ones are emergency room.
Yeah, that's emergency room.
The second tier, was it dislocated? Or was it torn?
Yeah.
Ligament.
Yeah, the ligament is torn.
Yeah. Ligament torn equals surgery.
Mm-hmm.
Fabulous.
Yeah, dislocation definitely ER. Gotta get relocated as soon as you can. More time that it spends out, the harder it is to get it.
Interesting.
Yeah. So yeah, then I was thinking ligament, but the thing was that it was just like so hard to examine. One, because it's my own arm,
Yeah.
and two, because the whole thing was painful. So I think that was really interesting
Yeah.
to sort of see how like acute injuries are hard to examine, and it's hard to get a clear picture of exactly what's going on. So it's just more of like a nice indication to me that like you don't have to diagnose right away. You just have to and be okay with not knowing what's going on the first couple of days, as long as it's not dangerous. And it's like you don't really know what's going on, but it's stable. I can move it around a little bit and it hurts, so I don't think that I have to have immediate surgery.
Yeah.
If this whole thing was like, you know, just completely torn, both sides, and like it felt so loose,
Yeah.
you don't want to leave it like that for a long time. But it felt relatively stable.
Yeah. So people who do jiu-jitsu listening are probably wondering, like, if I get hurt, I don't have that knowledge base. This episode is helpful because you give some information. But what would you say is like their resource? Of like, if something happens, who's the person to call? Because with body stuff, it can kind of be hard to tell. You're like, do I go to the ER? Do I go to urgent care? Would you recommend like a trusted physical therapist?
Yeah.
To be kind of that reference point.
100%. I mean, so there's sort of like it's not a battle, but it kind of is. So as physical therapists, because we're kind of late to the healthcare game, we are sort of always trying to expand our scope. Not because we're trying to be hungry and like be in control of everything, but because the sort of circle that we're in right now, one is growing, and we're trying to figure out where we belong in the healthcare system, but also we can be used as something more than what we are. I think a lot of people think that physical therapy is like, I just had surgery and I need rehab from surgery.
I just had surgery and I need a physical therapist to teach me how to do the external rotation.
Yeah. But physical therapy is so much more than that. And I think the new sort of, but my point in that was saying that physical therapists are sort of fighting to become a sort of primary care. You know, we're not like the GI people. Like if you have stomach pain, you don't come to a PT. You could, because we could quickly tell you like, hey, this is not a muscular thing. You need to go see a GI specialist. Very similar in the way that primary cares act now, except that they prescribe medicine. And that's kind of part of the issue, is that you go see your primary care and you're like, man, my elbow is killing me. And they either send you to a specialist or they're like, just wait 6 weeks, take these anti-inflammatories, maybe here's some, pain meds or something, and then just go about your business.
Right.
But that's where we belong. Is anything musculoskeletal, that's us. Because not only can we start to wean you off of anti-inflammatories to begin with, which aren't that great, they do a really good job of controlling swelling, but if the swelling is controlled, you don't need to take it. because you want the swelling there. It's a very natural part of healing.
When you say if the swelling is controlled,
Yeah.
what would uncontrolled swelling compare to controlled swelling?
I think if it is really, really hot, really puffy, that's uncontrolled. If the skin starts to
The skin
stretch,
is hot.
yeah. But if it's swelling and it's like discolored, it's like, that's fine.
Yeah.
But if it looks abnormal, that's a good time to question it.
Red,
Yeah.
stretched,
Yeah.
irritated.
It's starting to really stretch the skin. That's the time that's like, all right, maybe I should take some antidepressant or some, yeah.
Yeah. Okay, great. So what I'm hearing then is if someone gets hurt in competition
Mm-hmm.
and they have a physical therapist to reach out to,
Yeah,
then that would be a great starting point.
100%.
Recommended over their primary care physician.
Yep, and especially with ER. The ER is for emergencies. This is not an emergency.
Yeah.
If you can talk and you can walk, you're probably pretty fine.
Unless it's one of those things that you mentioned.
Yeah, unless there's a dislocation, like, I mean, that, you know, the things like that are a little bit more dangerous. You gotta go to the ER.
Those are ER.
Yeah,
But
if it's
outside
like,
of that, ER's not really going to be that productive.
no, not at all. That's when you go see a PT, because we're movement experts, and we'll get you back to moving the way you should, or at least direct you in the right position.
Right. And help navigate you through the injury.
Yeah.
Okay, great. So that's acute response in the moment was ticking through your head.
Mm-hmm.
And how we would maybe think about it if we're just a normal person.
Uh-huh.
What happens next? So you were like, all right, I don't need to go to the ER.
Mm-hmm.
I'm not going to need surgery. I can wait this out to figure out exactly what's going on because at present, there's too much happening to know exactly what's going on. So what do the next, what's the like first 24 hours look like for you and what do the next few days look like? My main question, did you take ibuprofen? Did you ice it? Did you heat it? What were the things that like, yes or no to this?
Yeah, the only reason I did take ibuprofen, the main reason that I took ibuprofen is because Vince gave it to me.
Oh.
Yeah. He just like hopped in and he was like, I'm gonna take care of you, because I went and saw there was some athletic trainers that, because I really wanted a sling because it hurt to hold up.
Yeah.
And I felt like my bicep hurt, like I just didn't want to hold it, so I wanted to put it in a sling.
Yeah.
I wanted some compression, and that was really all that I wanted.
Yeah.
And so Vince just like ran me over there, and he was like, make him a sling. Make him a sling right now. And I was like telling them, and they were trying to like, you know, ask me other questions, and he's like, make him a sling. And then he didn't even ask, he just grabbed the ibuprofen and gave me, and then he's like, here, take these.
Oh my gosh.
Yeah.
I love Vince and taking them.
Vince also has a background in emergency medicine.
Yeah.
Yeah, he was a PJ for like 9 years, so that's what he did. He took care of people, but
That's great.
in
And
emergencies.
for context, if you don't know, Vince is one of the other owners of East Austin Jiu-Jitsu Parlor, which Sean is one of the owners of as well.
Yeah.
And they're friends.
We're best friends.
So it's a really cute story that I take care of it. Anyway, so,
Yeah, so I did take ibuprofen.
but you wouldn't have,
I would
probably.
have.
For what?
Nah.
Why would you not have chosen ibuprofen?
I would have taken it to go to sleep.
Got it.
But while I'm awake, I kind of like to not necessarily feel the pain, but just kind of have a good idea of where the pain's at. If it's like so painful that I'm having trouble concentrating on the things that I'm doing and just like, dying in the back, I would take it.
Yeah.
But I wasn't like that.
Yeah.
I
So the reason you would take ibuprofen initially would be for discomfort.
Yes.
Not necessarily to like get ahead of inflammation or like any of these reasons that kind of like the reputation of ibuprofen with injury has. People are like, I should take ibuprofen because it's going to help me heal.
Yes.
But that's not the reason we take ibuprofen. We take ibuprofen to moderate our comfort levels.
Yes.
Early in injury.
Yeah. That's well put.
Thank you. Thank you very much. I like to explain concepts.
Yeah. So then the first
ibuprofen is a no for you.
ibuprofen is generally a no unless I'm trying to
Useful
sleep.
tool,
Yep.
but not for the reasons maybe that we've maybe perceived them in the past.
Because the main thing that I was focusing on was movement. I'm trying to control swelling. I'm not trying to get rid of it. It's there, good.
Let it be.
That means that my body's
That's
doing
part of the
stuff.
healing process.
Yep. And it's it's your body doing its thing. All that stuff that's torn has to go somewhere, and all the things that are helping to repair it and to pull all of that
They
stuff,
gotta get in there.
they have to be somewhere. It's like a little parking lot.
It's just increased transport.
Yeah, busy highway
It's just a
system.
really busy parking lot right now.
Yeah. So I was focused on movement, as much movement as I could do that I could tolerate,
Okay. Which was what at that point?
which was basically this.
Cool.
That was pretty much it. I was doing a little bit of this, but not too much.
So you're like, I'm gonna keep moving it in the ways that are tolerable, that I can, that don't cause
Yeah.
yikes pain.
Yeah. It's
Like
uncomfortable.
uncomfortable, but it's nothing like sharp, stabby that the body's like, yikes, don't do that.
And I'm not trying to push it. I'm just trying to take up as much as the body will let me.
Yeah, seeing what it'll do and doing that.
Because the whole first, week or so is all just like stepping away, letting the body do what it's gonna do, giving it a little bit of motion, but just mostly leaving it alone.
Trying not to stress it out.
Yeah, yep. But I do want to move it as much as I'm able to.
Love that.
Yep.
So is that still the mode that you're in? Let's see, how long's it been?
What's interesting is today is the first day that I'm kind of not in that mode. I had a really good session, which was kind of surprising. This is what I was hoping for, but it surprised me that it worked so well. I was, so the past couple days, or the past week or so, I think it's been 2 weeks.
Coming up? Yeah, it's been like a week and a half.
Week and a half.
It happened on a Friday, I guess.
It happened on Friday.
So it'll be 2 weeks on Friday,
Yep.
and today that we're recording is a Tuesday. So it's been 11 days.
And so basically, up to this point, I've been just moving it. I'm trying to put pressure on it, but it hurt, and I was like, it's not ready for it.
So you're listening to it. Let me tell you what to do.
Totally avoiding everything except for eating. Once that became like, okay, I was having a hard time eating because I just couldn't bend my elbow, and also like digging my fork into stuff, just couldn't do any of it. So I was using my left hand.
Oh, you weren't just...
Yeah, I had a lot of soup.
Oh, nice.
Yeah.
That's great.
But as soon as I could eat, I was eating with it and just kind of like assisting with my other hand, but trying to use it as much as I could.
Yeah.
But I had this steam session last night. I have a steam room here, which is great. And I got to the steam room, got my elbow super warm, and just kind of pumped it. I was almost thinking about like, I use this analogy a lot, but like getting a pump from bicep curls, where you can just keep kind of hammering away and you feel it directly in the bicep. And so I was trying to do the same thing with my forearm and my bicep and my tricep, just the whole area, just like trying to pump it up. And I was just
up the James, pump it up.
Just fill it with blood.
Did you have a band or anything, or are you just doing this
Nope.
like just pure focus?
Exactly like this.
Just focus on getting a little just you sitting in the steam room.
I was doing
Get
this.
a little pump on.
I was doing this. There was a guy in there, but I'm pretty sure he was
Who
like,
was it?
I don't know.
That's fine.
Yeah.
Were you doing this?
I was.
That's great.
And then
So you got a pump on
I
in
got
the
a
steam
pump.
room
And
to get
then
some blood flow to the area.
to get some blood flow.
In all seriousness, it's for a reason.
Yeah. That was the main reason that I did it, was for blood flow. And then I stretched it a ton. Didn't push it, but just took it as far as it was comfortable with. Tried to hit some isometrics there. If it hurt, I would like back off. And then doing the same thing in flexion and just kind of squeezing and just trying to see what it felt like to squeeze as much as I could and push towards in range.
And how did that feel?
I mean, it felt the same as it always does, stiff. And it just felt like, so like right now, this is as much as I can bend my elbow, and I can feel the quality of it. It's really interesting because this is like a very unique, like tactile feedback that I get from patients while I'm like assessing them. I can tell the difference between like, this is the end, this is a hard range of motion and it's bone on bone, or like, this is swelling. Because it's like gushy, squishy. It's like I'm running into something that gives me more resistance. It's like bouncy almost.
That makes sense. Yeah.
And that's what I feel.
It's not a hard stop.
Yeah.
It's a soft stop.
It's a soft stop. And there's,
And you're feeling it now from like actually experiencing it.
Yeah, I'm
in
experiencing.
your
So it's
life.
really interesting to
It's very interesting.
feel it not through my hands, but through the actual
Yeah.
joint.
Yeah, that's cool.
But some of that went away.
That's lovely.
Yeah, I'm able to
That's
extend it, not
Yeah.
completely, but it looks a ton
It
better.
does. Yesterday, you weren't, or last time I saw you, you weren't quite fully extended because yesterday. So that's very exciting.
Mhm.
Okay, so that's what you did today.
Mm-hmm.
Um,
Yesterday.
yesterday.
That was
Okay.
the steam session.
Steve session was yesterday. And the reason for that, so I want to create kind of like a flow chart.
I think we missed something
Oh,
though.
what did we miss?
We talked about the potential things that it wasn't,
Yes.
but we didn't talk about what it is.
Oh, you're right. We
Yeah.
didn't.
The actual diagnosis.
Yeah,
So-
because we wanted to give it time before we had real answers. But
Mhm.
we've had that time and we have real answers.
Yep.
And this is what the people want to know.
Yeah. And one of the things that I was really, really curious about that I couldn't figure out early on because it was so painful was the status of my ligament.
Status of your ligament.
Yeah. And so ligaments are bone to bone, non-contractile. It's just a thing that keeps the bones from going where they should.
Let's explain that a little bit. Non-contractile meaning not muscular tissue.
Yep.
They don't contract.
Yep.
They're not generating movement. They're just soft tissue connection points.
Mm-hmm.
Like firm, more firm,
Yeah.
but
They are generating. Yeah. Anyway, that's what
energy
it
travels
is.
through them.
Yes.
But they're non-contractile.
Yeah, they don't create any of the movement. I think that was what he said, but it is maybe.
No,
Yeah.
no, I appreciate the clarity. So bone-to-bone connection
Bone to bone
is
connection.
a ligament.
Mhm.
A tendon is a bone-to-muscle connection.
Correct.
Got it. Thank you. So right now we're talking about your ligament
Mhm.
connecting what two bones?
It's connecting your humerus to your ulna. And the nice thing about anatomy is that this is your ulna. So this is your ulnar collateral ligament. So it's just nice because it's named after it.
That is nice.
Yeah.
Thank
So if you know the bones, you can know the ligament. It sometimes it's a little wonky, but
Sometimes
it's easy to remember.
Got it.
Yeah. So my UCL, this is the same ligament that you get the Tommy John surgery.
Mhm.
This is very, very predominant in pitchers in baseball. They also call it little league elbow, where you start to stretch out your UCL because you're just doing
Because our
this.
sports are no longer seasonal and we're just playing the kids year round and
Yep.
yeah, anyway, that's a whole other podcast. But
So I was concerned if it was my UCL.
yes.
They have a decent, like it's a complete tear, so we call it grade 3, complete tear. The chances of it healing on its own are pretty good.
Okay.
It'll reconnect, but it just takes forever. And so this is why,
Why people do Tommy John surgery.
yeah, it's a little bit quicker healing, it's more predictable, and you come out with a stronger ligament.
Oh, are you a little disappointed?
No.
Okay, so it's not a UCL tear.
Yeah, not a UCL tear.
Not a UCL tear, period, at all.
No,
Is it a UCL strain?
I don't think so.
Cool. So it's your UCL is happy.
Yeah, it's fine.
Happy as a clam.
Mm-hmm.
Why is your UCL happy? Why? What's your theory? Why do you
Yeah.
think your UCL is fine? Because I would assume that typically if that happens, your UCL is probably not fine.
Yeah. And you know, in jiu-jitsu, there's not a ton of data. And so most of it's just kind of using anatomy and or like functional anatomy to figure out what the injury would be. Obviously, we have some data on it. But what it seems like is predominantly with this injury, you tear your UCL.
Yeah.
That's kind of the first thing that goes is your UCL. My theory. So what did tear was some of my forearm muscles. I'm thinking that's pronator teres, which is the guy that pronates. I also think it's a little tiny forearm flexor that lives on the bottom side. So maybe like ulnaris longus.
Which she do this.
Yeah, which does this, but
She
it also
this
does
and
this. Yep.
She's multifaceted. And she's torn.
And she's torn.
She's injured, right?
So I think it's these two. But the interesting thing is that when you have a distraction injury on this side where it separates. You also have a compression injury on the other side.
Yeah.
So my radial head
Oh.
got compressed in the joint. So this thing is
Gross.
pissed.
Gross. Is that uncomfortable?
Yeah, very.
That sounds way more uncomfortable than the muscle.
It is.
Yeah, because it's deep.
And it's tiny. And it moves all the time.
Okay. So that's uncomfortable. So
This
those
is
so
uncomfortable.
far we have gathered
Mm-hmm.
UCL, which is a ligament, not torn.
Not torn.
Muscles in the forearm,
Torn.
yes, torn.
Yeah.
And humeral head,
My humeral head. My radial head.
radial head.
Yep.
Oh, okay. See.
Yeah.
Radial being the one in the forearm.
Yes. So you have two in your forearm, ulna, and radius.
And they go into the humerus.
And they go,
Or like they're
sure.
linked up.
Yep.
Yeah, they link. The two link with the one.
Yeah.
And it's the one in the forearm.
Mm-hmm.
Got it. Anything else?
Labral tear.
Labral tear.
Mm-hmm.
Nice. I
From my
know that.
labrum.
I learned that right now. How do you feel about that?
Better every day. I was pretty upset about it at first.
Why were you upset about that? What does a labral tear imply?
So the labrum is something that deepens the socket. Your hip socket is very deep. It still has a labrum around it, but it provides good suction around.
It's in there.
So you have the socket, and then the labrum goes around the rim.
Okay.
And so it's almost like a rubber seal around it. And so it provides a little bit more stability, but it also creates this nice like suction. And yeah. Where the shoulder is not very deep.
It's like,
Yeah, it's like this, with a ball sitting on top. It has like,
it's really not deep at all.
yeah, it's
not
not
even
deep.
like this. They're not even doing this.
No.
I always kind of imagined it like that.
It's
It's
hardly.
less than that.
The general like analogy that people use is a golf ball sitting on a tee.
Wow.
Yeah.
Vulnerable.
It's got a little thing to spin in, but it doesn't really provide much
Well, but
stability.
it sure gives us a whole lot of freedom.
That's the thing, exactly. Yeah.
We can do all sorts of dances that we can't do with our hips.
So specifically on the shoulder, the labrum is really, really important because it provides these guardrails so it doesn't slide over. Also the muscles do too, but this is kind of the last resort.
Mm-hmm. So the labrum of the shoulder, we're talking like music golf ball on a tee.
Mm-hmm.
Does the labrum only cover the surface area of the tee, or does it extend past it around the golf ball at all?
Hardly. It touches the golf ball, but it's attached to the tee.
Okay. It's not giving it like a whole.
No, it doesn't go around. There is a thing that's the joint capsule.
Okay.
It's not very tight, but it does go completely around that entire joint.
Okay.
So it has a bigger role in the shoulder than it does in the hip. And typically labral tears in the shoulders, they don't really heal that well. Especially if they're bad. They're chronic and
Do they cause discomfort?
yeah, lots of
Uncomfortable.
clicking.
Is that the kind of thing that would benefit from surgery?
Yes.
Yeah. So it is a circumstance in which you would perhaps
Yeah.
have surgery.
Mhm.
So is that something that you're considering?
Not anymore
Go on.
because it's getting better.
Amazing.
Yeah.
If it were to stay the same or get worse,
Yes.
you would have considered surgery.
Yeah, for sure.
And that would mean pain, clicking, instability, or that would just mean pain when you say staying bad or getting worse? What does that mean?
It would. So what would it look like if it got worse? I think if my range of motion didn't get better, and the clicking stayed, and the feeling of instability stayed.
Okay.
It's getting more stable. My range of motion is clearing up, but the clicking is still there.
Okay. What about pain?
Pain is pretty okay.
Would you anticipate someone with a labral tear would have pretty consistent pain predictably from that time forward, or would it be the kind of thing that you get more comfortable over time? Like, it's going to stay painful. Interesting.
Yeah, it can get better.
Yeah.
And if it does get better, it's fine. Don't worry about it. But if it stays the same, maybe kind of like plateaus and just
Like, stays persistently the same level.
yeah, because
So, but your pain is getting better.
it's getting better.
Cool.
Yeah, all those metrics are
That's
improving.
amazing. Okay, sweet. So initially you were like, oh, no,
Yeah.
labral tear. But
Yeah.
you're feeling a lot better about it because it's improving.
Mhm.
Okay. And if it wasn't improving, you would be tracking down the avenue of perhaps this needs surgery.
Yeah.
Okay. Very interesting. Okay.
So my hypothesis.
Yes. The hypothesis regarding why it says UCL not torn. That's what we're returning to.
Yeah.
We got so sidetracked from.
Mm-hmm.
That's a big question.
There's two possible answers here. One that I like better than the other. One, the possibility is that maybe he just didn't crank it that hard.
Yeah.
Which
It's not that. If you saw the video.
Yeah, I don't think that, just because of how fast it came on and the fact
I concur. I don't think
that it also went upstream and got my shoulder. So that means that my elbow had to have been locked, no more range of motion in my elbow, and it started to go up to the shoulder.
Yeah.
Or the other reason is because the capacity of the tissues are so high that they can withstand the force before the UCL.
I'm going to try to say that again in words that people might have a better understanding of. That perhaps the musculature is strong enough to take the hit.
Yeah.
For the ligament.
Uh-huh.
That because you have a strong line of defense in the musculature, the UCL wasn't injured.
Mm-hmm.
Because you have so much muscle. It's because you're jacked.
It's because I'm strong. I think that's a better thing.
Sweet.
Yeah, because I'm strong.
Yeah.
And because I can take force.
Mm-hmm. Being strong and having strong tissue leads to better outcomes.
Yeah. That's why you should be strong.
That's why you should be strong.
Also, that's why you should buy our program. This was just a commercial. This whole thing was just a commercial to buy our program.
Exactly. News alert, you can now get East programming online from anywhere, which is the programming that Sean does himself, and also that the members here at East Austin Jiu-Jitsu Pro do, and the athletes that visit here, they do it too. They just do whatever Sean tells them to do.
That's right. Well, some pizza here.
Yes. Anyway, so you can now do this programming from anywhere, fully guided, lots of videos. One of the videos has 2,000 views on YouTube Shorts.
Hot on YouTube Shorts.
It's viral. I'm going viral right now as we speak. I bet it's at 2.2, and it has 3 shares. They're all
three of them for her.
They're all 3 me to my mom and my 2 best friends. Sean, earlier we were talking about it. I was talking about how many views it has, and he goes, "Yeah, it's got 3 shares now too." Oh, it was wrong. It's all me. Anyhow, but it is true. Being stronger is the move, man.
But here's the interesting part: is that there's not really a lot of data on this, right? It's hard to study that. You can kind of hypothesize, and you can come up with these, deep physiological findings, but you can't test it because you can't injure somebody.
It's unethical.
Yeah, you can't see what happens, and
but right now we're getting to see what happens.
Yeah, exactly. This is a one of one.
Yeah.
Yeah. Also, I think another interesting thing is that I've never really seen a video or a podcast or anything about a physical therapist getting injured and sort of talking about his recovery. Yeah,
it's cool.
There's some people out there that have seen it before. One interesting thing that I was thinking of before we started this. Do you know who Ido Portal is? Oh, yeah.
Really?
Yeah, you gotta look him up.
Okay.
Interesting guy.
That's a cool name.
Very, very interesting. He's from Ireland. No, sorry, Israel. I thought person that came out of Ireland.
I see.
He's from Israel.
Cool.
And he's very worldly, travels all over the world, and he studies movement.
Cool.
He's the movement guy. I get a little bit lost in some of his descriptions. He kind of gets esoteric with it. But yeah. But when you watch him move, you're like, whoa.
Cool.
This is the guy. He's got a lot of interesting concepts. But anyways, one of his sort of disciples, which is I think an appropriate name, because he does have a really, really fanatic following. The people that follow him.
Did I just find my cult leader?
You might.
Cool.
But one of his disciples was doing some crazy thing on the ring. You know, Skin the Cat?
Yeah.
Yeah, he was doing it on the rings with one arm. He was going around on the ring and holding himself.
Oh, okay.
The ring is pulling that way.
Sounds
and he's
like-
facing down. They do a lot of ring work.
Yeah. I mean, it went well
It did not.
though? Okay.
Yeah, completely towards pec.
Yeah, I was gonna say, I'm
Yeah.
so concerned about his one arm ring.
Towards pec. So he documented, I think it was
Did
like,
he do it on purpose to document the other guys?
you never know.
You know,
Yeah.
you know what would be fun? So he documented it, and that's a contact.
Yeah. But it's interesting to look at because the thing was purple. And, you know, over the next couple of days, he's using this kind of same thing that I was talking about, where it's just like, try to move it as much as you can. And, I mean, he's basically doing a push-up within a couple days. I think that's too fast, but it is interesting to think about what the human body can do.
Yeah.
And how much of it is just a mental block.
100%. Well, especially when we have so much belief built up around the fear of like taking care of it and healing it, right?
Yeah.
I guess because a lot of what I grew up thinking about with any sort of injury was like ice, rest, like elevate,
Yeah.
you know?
Yeah.
And as we're learning more about how the body heals and how we can facilitate that, that's maybe not the preferred course of action. Would be like, yeah, in the past would have been my instinct, like ibuprofen, ice it, don't move it,
Mm-hmm.
don't move it at all,
Yeah.
don't even let it move, and then maybe elevate.
Right.
But but what we're hearing more now is move it within the range that you can.
Mm-hmm.
Allow the swelling and inflammation to a degree that it's manageable in terms of your physical experience of it, like your discomfort, but also, you know, like you talked about earlier with the inflammation, what to look out for.
Mhm.
It's getting like red hot. Like let's damper that.
Yeah.
But allowing the body to move through that process, continuing to move. I would also throw in there like getting sufficient rest and
Yeah, for
food
sure.
and hydration is going to be helpful in the
Yeah.
healing process as well. But also we were talking about like what we believe around it, and if there's all this fear around not moving it, and that there's like maybe I need surgery or there's one right way to fix it, we get kind of lost in that fear and kind of locked into things
Yeah.
longer. But yeah, it's cool to see different avenues even if we don't need to be doing push-ups after the week.
Yeah.
Okay, so what I want to do next is I want to kind of project it out a little bit. What's your plan for your movement today? Kind of how are you approaching the next few weeks? So that if someone's watching, they find themselves in a similar predicament.
Mm-hmm.
They could kind of conceptualize maybe what a path forward looks like by understanding yours. But before you do that, I just wanted to pitch the idea to get more data. It could be kind of fun to get this guy to throw this same mirror walk.
Mm-hmm.
Could he do it on Roman?
Uh-huh.
And then like a few other people. We'll take different, you know.
Ooh, okay.
But Roman's definitely one to choose,
Right?
right?
He's the strength guy.
Yeah. Lots of muscle.
Mm-hmm.
Who else though? Who would be? Who else would be fun? Who else?
I think
Who else is
we
our data
might have to
set?
go like the other way.
Mhm.
Someone who's like super strength focused and then hit the other side.
Yeah, who's like very technique focused.
Yeah.
Who's not in the school of.
Maybe like what's his name? Marigali. Yeah, I mean, he already had the shoulder thing.
Okay.
Did you know about this?
Mhm.
Yeah.
That's good.
Yeah.
Okay. Well, there we can build like a pool for data.
Yeah.
And this is a good experiment, right? We'll just pull the guy in. We just...
We just do it on our own.
No, it needs to be recreated.
No, but I'm saying we just
Oh,
completely
yeah,
do the study
yeah.
on our own.
I thought
Fund
that you
ourselves.
threw a mirror on. I
Oh,
was like,
no,
no.
we have a machine that does it. That way it's systematic.
Yes. It'd be fun.
Yeah.
We can't, unfortunately. Anyway, go ahead and lay out expectations for yourself for the next few days. What are you maybe planning on doing
Yeah.
today? You're certainly not doing jiu-jitsu at the moment.
Correct. Yeah, I'm lifting but it's all modified stuff. I'm using a safety bar squat, not doing any upper body except for on my left. And then basically what I do on my left, I'm doing on my right, whatever I can.
Got it. So if you were doing bicep curls on your left, you're gonna then do your body weight super focused curls on your right.
Yep. And then I think really it's just testing, because the next big thing for me is putting weight through it. Range of motion is still limited, so that's going to be a big factor, but I think the first thing that I'm always thinking about is full range of motion. Once range of motion is close, then I'm thinking about strength. And it doesn't have to be like, the 1 rep max, but I'm thinking about getting activation of the muscles back. Can I squeeze my bicep? Can I squeeze my tricep? Can I hit supination, pronation, flexion, extension? Can I grip with my hand?
So moving in all kinds of ways.
All kinds of ways.
With whatever resistance is tolerable.
And
that could be as low as nothing.
Nothing.
Or like 2 pounds.
Yep.
5 pounds.
Typically the way that I start is an isometric.
Great.
Doesn't even have to be 100%, but I'm just not even moving into flexion. I'm just hitting a flexion isometric or an extension isometric. And once that feels fine, then I move to concentric. And then I add some load, or I start to progress exercises to more like body weight things. So I'm still in the isometric area because my extension is still kind of
Your
wonky.
range of motion isn't quite there yet.
Yeah, and there's still just a lot of swelling in the joint, so I don't want to push it too much. But the next thing would be maybe planks, but putting some weight in it to just get it nice and stable while it's in extension. So I'm thinking about like the in range, stable within extension, and then stable within flexion. So like some presses, or some bench, or some deep dips, or even if it's just like range of motion stuff. But hitting range of motion with some load through it at either end of the range of motion.
So
that's what's kind of the next 2 weeks. Yeah.
And we'll do another episode in a few weeks on this topic.
But I think the big sort of thing that I'm shooting for is somewhere between like 4 to 6 weeks before I go back to doing strength conditioning and starting to drill in jiu-jitsu, but starting with drilling.
Starting with drilling. And when you say starting with drilling, what does that look like? What does it mean to just drill?
Yeah.
Because some people go to gyms where you're just full send all the time.
Yeah.
Which is, for the record, not what we do here.
Yeah. So obviously doing the class and doing the drills that are in class.
The technique has been taught.
Yep. It's sort of a technique, and it's also a nice slow pace where I can kind of feel like, ooh, don't like posting.
Posting,
And it's slow, and my opponent or my partner, he's not really putting a lot of body weight, so I have time to react and I have time to assess, and it's not just like what's my natural reaction. And so I can sort of test it in that way to see how it's doing and see like, okay, don't post. Yeah, never post. Because that doesn't feel good. And then I'll probably grab some people and do some more drilling.
And just,
yep.
You
But no live sparring, no flow roll, no nothing where I'm just drilling.
Control.
The positions are controlled, the things that I'm working on are controlled.
Resisting, really. Like you're just giving enough resistance to feel the technique of the movement, not enough to actually try to prevent it.
Yep. Very controlled.
Very controlled. Great, so that's your kind of target. If you said 4 to 6 weeks, you'll bring that in. So until that time, you won't even be doing that. You're going to be doing what we've already talked about. At the 4 to 6 week mark is when you anticipate getting a little more normal in your strength and conditioning.
Yep.
So like probably loading both sides a little closer to equally. Maybe we'll see how it feels, but and then doing like maybe an actual like back squat barbell instead of like the safety bar that changes how you can hold it or how you hold it. Okay. 4 to 6 weeks, those changes start to come in. Maybe that's when we reconvene. Yeah. Anything else that you want to say on this topic? anything you want to say to maybe someone listening who is navigating an injury or helping a training partner navigate an injury?
Yeah, I think injuries are natural and normal, and I think people fear them so much because you fear what you don't know. And so I think, obviously I'm going to say go see a physical therapist, but I think more importantly, you have to find someone who can help you understand your own body and understand injuries, because this is your body and you should have some awareness of, is this dangerous? Is this not? Am I freaking out? Am I overreacting right now? The amount of patients that I have, and I'm not judging them, I'm just stating the fact that there's a lot of people who really haven't been hurt before, and so when they sprain their ankle, they're freaked out and they think that it's broken, and but it's just a normal sprained ankle that happens. You're walking on it, you're probably gonna be okay.
And having faith that A, your body knows how to heal.
Yes.
And
yes.
B, you're well resourced with information to facilitate that healing, especially if you have a great physical therapist to help speak into the process.
But I think owning that and making it a part of your knowledge base. You don't have to have a super in-depth knowledge, but just being aware of these sort of minute things and how well your body can do what it's meant to do. It can help, our bodies heal. It's interesting that Wolverine is sort of this superhero, but our bodies heal.
That's a good point.
You can break a bone and it heals.
That is crazy.
You just have to get out of the way and let it do its thing, and it heals. I mean, it's pretty amazing.
It really does.
Yeah. We can't do that with anything else. We have not made any technology that is self-healing.
That's fascinating.
Yeah.
Huh.
Yeah.
Yeah, that is fun that Wolverine is he does it really fast though.
He does it really fast.
And the way his
Yeah. And his bones are also made of whatever,
are they?
steel or something, yeah.
Okay.
Yeah.
He doesn't have to worry about healing those. But
Yeah.
We'll wrap it up with a fun story from my childhood.
Oh.
When I was 5, I was jumping on the trampoline with my oldest brother, who is 7 years, I think, older than me. And he really liked this fun game where he'd jump as high as he could and then throw me as high as he could. Because I've always been quite small, so people like to see how high did he throw you. I hated this. I didn't want to play. As he's throwing me in the air, I'm pretty sure I was saying, no. Anyway, when I land, he's yelling at me, land on your butt. Because if I land on my butt, everything's gonna be fine. I'm not in danger unless I which I do. So I throw my arm out, snap my little arm. Broke my arm when I was 5, that's the story. They cast it, etc. When we go in for one of the last appointments, they discovered that it healed misaligned.
No way.
Yeah, so.
Oh, wow.
Isn't that fascinating?
Yeah, so.
So my poor mom went in to get my cast off. She went in to get the cast off of her 5-year-old. And they said, actually, fun fact, it healed misaligned, so we need to re-break it, recast it, and she's got to do this all again.
Yeah.
And sweet Kathy said, they wanted to do it with me awake, just with a little bit of it. I did the first. I just want to snap my arm.
Wow. Do you
my
know how
mom
they
said
snapped it?
no. I have no idea. I would love to know. But, oh, it's so crazy. Yeah, no, they put me under though. I got
They did it like that. How did they do that?
I have no clue. But imagine, I'm going to work today. On the doctor is breaking a 5-year-old's arm. Crazy. That poor doctor. That probably was sad.
Yeah.
I dreamt about Aladdin though. On the magic carpet.
Oh, wow.
I remember that.
You were so high. You're on the magic carpet.
Yeah, I had a great time.
I bet.
I'm pretty sure my brother got McDonald's that day. Dave got McDonald's, I'm sure. Anyway, so I broke my arm when I was 5 and I had to re-break it.
That's intense.
So, yeah, as long as we stay out of the way and make sure it's casted.
Yeah. Sometimes it goes wrong.
But our body's capacity to heal is pretty incredible.
Yeah.
In conclusion. Alright, sweet. Any last words before we sign off?
No, I got nothing.
Sounds good. Thanks so much for yapping about your injury.
Yeah, thanks.
Thanks for joining us. We'll see you guys next time.